right. Hey, everybody. My name is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance. We're back again with another episode today. And the interesting thing today is I have both of my colleagues, Dr. Ariella Naim,
hello,
as well as Dr. Alexandra Zweig. And we're doing these videos because we figured it would be a really good opportunity to answer questions that we get in our clinic, in our practice here in New York City on a day-to-day basis. Considering we're not in the office, we're all in our homes. So how are you guys doing today?
good. Yeah, hang in there.
So today we're turning the tables a little bit. For the past few episodes, I've been the one asking the questions of you guys, and today you guys will be asking some questions of me, and I hope I'm prepared. So I'm going to let you guys fire away.
We're about to test you. All right, so we're going to talk a little bit about vestibular today. So my first question for you, Dr. Kasper, is let's say I'm someone who's experiencing dizziness for the first time. Who is the first professional I should see? And is New York Hearing Doctors or NYHD Institute for Hearing and Balance? Would that be a good place to start?
That's a really good question because we get phone calls from patients and prospective patients all the time. They reach out to us online with questions of, I'm dizzy, where do I start? A lot of times it starts with, okay, is the dizziness something that's acute? Is it something that has happened suddenly? Or is it something that's been with you for a long period of time that you've been kind of managing and there's been kind of fluctuating symptoms? I think either way, the most important thing to understand when it comes to someone who's got symptoms of imbalance or vertigo, true spinning, is that the process is multidisciplinary. It's not just us as audiologists. It's not just us as the person who's doing the diagnostic testing and some of the rehab. It entails a whole team of people, and that's how we prefer to work in our practice. It's us as the audiologists. We're working very closely with certain physicians in certain specialties like ear, nose, and throat doctors, otolaryngologists, neurologists are very important. Your primary care doctor can be very important. Cardiologists, endocrinologists, all of these doctors play a role in terms of potential entry points for someone who has dizziness. Now, what I feel is always really important is that clearly your primary care doctor checks you out, make sure that there's nothing that's life-threatening when it comes to dizziness. A lot of patients, as we know, end up in the emergency room for vertigo or dizzy problems. And I'm not saying that's a bad place because clearly we do want to rule out things like stroke or heart attack that are life-threatening. More often than not, that's not the case with the patients that we're seeing. So entry point might be your primary care doctor, your ear, nose, and throat doctor, even neurology sometimes. Regardless, those patients are going to come to see us at some point. So we can actually fill in the gaps and really try to assess what part of their system might be causing the dizziness or the imbalance or the vertigo. And we have to differentiate, as you guys know, between different symptoms. So what I would say is it's multidisciplinary. I'm not really concerned necessarily where the entry point is per se. What I'm most interested in is this multidisciplinary collaborative approach with all the docs that I mentioned earlier. And sometimes we're even bringing professionals like optometry into the mix because sometimes it's just a visual issue that has to be addressed, or that might be a component of it.
Yeah. I also find that because we work in ENT offices or work closely with ENTs, that a lot of dizzy patients that we see have already been to a lot of professionals that might have not been the right path to start. So even if they did start with us, because we know that we're confident enough and we have this pool of people to work with to at least direct them in the right place if we're not the right place to start necessarily.
Yeah, I think that's actually a really, really important point there is that, we do get these phone calls all the time and we get these contacts from patients all the time. More often than not, we're actually referring them to someone before they come to us just to make sure that we're covering all bases. Now, if they've seen neurology before and they've seen their ENTs before, sometimes people are looking for second opinions. As audiologists, we do need to have a referral from your primary care doc or one of your physicians to come to see us. But, we're always happy to look through what they've been through already to make sure we're not replicating or putting them through unnecessary testing to find the answers to what's causing their problem.
So I guess on that point, once you have the referral from your ENT or your primary care physician, and we come see you, what exactly is involved in vestibular testing?
Yeah, so that really is highly dependent on what the patient's been through already in certain cases. But for most people, there's not just one test for assessing dizziness. I think the first thing that every single patient has to have when it comes to imbalance or dizziness, clearly outside of their general physical and making sure their blood pressure is okay and their blood glucose levels are okay. Let's put that stuff aside for a second. A basic hearing test is really, really important, because especially when it comes to certain types of issues that cause vertigo, which is true spinning, where the world is rotating or you feel like you're rotating, more often than not, it can be an inner ear related issue. And a lot of times we can actually see some changes in the person's hearing that will give us some signs as to what might be going on. So basic hearing test is really, really important first. And before we get to the hearing test, a full case history is actually going to tell us more than anything. What the person's symptoms are like, when they started, are they episodic in nature? Do they change based on position? If you roll over in bed or if you turn your head up or down, that might lead us to certain types of causes of dizziness as well. Have you had a concussion in the past? Do you have a history of migraine? All of these things come into play. So we really want to dive into case history, get a really good baseline hearing test. Understanding also if there are subjective changes in hearing. Ringing, tinnitus in the ears is a really important sign for us, especially one ear versus two. But once we get past that, what I do for every single patient is a bedside type of an evaluation where we watch how they stand on different surfaces. We watch how they move. That gives us some clues as well. And then on to some of the standard testing that we'll do. In some cases, we're going to dive into the inner ear a little bit more. We'll do testing of the inner ear as well as the nerve that comes out of the inner ear. Those tests are called ABR, or auditory brainstem response testing. Another test is called electrocochleography. Again, they sound really ominous, but we're just measuring things that happen naturally in the system. Another test that's done frequently is something called a VNG, video nystagmography, or ENG, electronystagmography. With that, we're watching eye movement. That tells us a lot about the balance system as well. In our site, we do something called rotary chair, which not many sites actually have, where we watch eye movement as we either slowly rotate a person in a circle. That tells us a lot about different parts of the system as well. And then there's other tests that we might look at, but that's kind of the baseline of what we're going to do for almost every patient when they walk through our doors to really assess balance. And that gives us a good, I would say, foundation to help understand where the person needs to go to after that.
Right, and I guess that really depends on what the results of the battery of tests that you did. But what are the next steps that you would take after a comprehensive vestibular evaluation? Like any referrals or?
Yeah, that's a great question also. So what do we do with all that information with the patient, from all the testing with the patient? Look, it depends on what the results are. If neurology makes sense, so for a lot of patients who are experiencing episodic vertigo or imbalance, migraine is something that might really come into play. So we might refer on to a neurologist who specializes in that. If it's an inner ear related issue, something like Meniere's disease, which impacts, say, the fluid balance inside the inner ear, and that can fluctuate as well, we would incorporate our colleagues in ear, nose, and throat to help manage that as well, as the hearing loss component of it. For a lot of patients, these things are, if there's not something that's necessarily, I hate to use the word life-threatening, but let's talk about the serious causes of dizziness, heart attack, stroke, all of those types of things. Oftentimes, we're going to be referring to our colleagues in physical therapy that will literally help they'll take our information, our pinpointed diagnostics, and then help guide the patient through a series of exercises to retraining their system. So it really depends on what the cause is and what we determine the cause is. And if it's outside of our scope, we're going to definitely refer on to our colleagues to help them manage those patients and get them back on the road to feeling better. So that's it. Those were all the questions today. That was easy.
Tomorrow's episode might be a little bit more difficult.
Tomorrow's episode will be more difficult. Well, if that's all the questions that you guys have for me today, we're going to continue these conversations, and I'm sure there's going to be a lot of questions regarding dizziness as we go forward, but this was kind of the entry point into that, and I appreciate the questions, and I'm sure that everybody else out there does as well. And because, again, I'm such a bad host, every time I keep forgetting to put this up, but if anybody out there has questions, we are very happy to answer them. This is not seen as medical advice. We're just trying to entertain you guys and give some information from our perspective. So just remember that disclaimer. But if you do have questions, you can send them to us at info@newyorkhearingdoctors.com, and we'll do our best to actually answer those in an upcoming episode. And if you're interested also in learning more about our practice, there's our website, newyorkhearingdoctors.com. You can learn more about Dr. Naim, Dr. Zweig, and myself, and what gives us the right to actually talk about stuff like this on a day-to-day basis. So that said, I really appreciate you guys. It's good to see you again.
You too.
And we'll catch up next time then, I guess.
All right.
All right. Be well, guys. Take care.
Bye.